Question 1. What is the most appropriate pain assessment tool for a 4-year-old child who is alert and verbal? A. Numeric pain scale. B. Flack scale. C. Wong-Baker-Faces scale. D. Visual analog scale. Answer: C. Wong-Baker-Faces scale. Rationale: the Wong-Baker-Faces scale is suitable for children aged 3 and older who can point to a face that represents their pain level. The numeric and visual analog scales are better for older children 7+, and Flack is ideal for nonverbal or very young children. Question 2. A nurse is administering oral liquid medication to a 10-month-old. What is the best method? A. Mix the medication with formula in a bottle. B. Use an oral syringe and place it toward the side of the mouth. C. Ask the parent to administer it. D. Place the medication in a spoon of honey. Answer: B. Use an oral syringe and place it toward the side of the mouth. Rationale: for infants, an oral syringe aimed toward the inside cheek reduces aspiration risk. Mixing meds with formula risks incomplete dosing. Honey is contraindicated in children under 1 year due to botulism risk. Question 3. Which action demonstrates family-centered care during the hospitalization of a 3-year-old? A. Asking the family to wait outside during care. B. Educating only the child about procedures. C. Involving the parents in care decisions. D. Encouraging limited visitation to reduce stress. Answer: C. Involving the parents in care decisions. Rationale: family-centered care includes involving caregivers in planning and decision-making. Limiting parental involvement can increase anxiety for the child and parents. Question 4. A nurse is assessing a 2-month-old. Which finding requires immediate intervention? A. Soft, flat anterior fontanelle. B. Moro reflex present. C. Yellow drainage from umbilical stump. D. Occasional eye crossing. Answer: C. Yellow drainage from umbilical stump. Rationale: yellow drainage suggests infection. The Moro reflex and occasional eye crossing are normal at this age. A flat fontanelle is a normal finding. Question 5. Which toy is most developmentally appropriate for a hospitalized 10-month-old? A. Puzzle with small pieces. B. Stuffed animal. C. Soft stacking blocks. D. Coloring book with crayons. Answer: C. Soft stacking blocks. Rationale: infants around 10 months enjoy manipulative toys like stacking blocks. Small puzzles are a choking hazard, and crayons require fine motor control not yet developed. Question 6. A nurse is caring for a toddler with croup. Which nursing intervention is the priority? A. Encourage oral fluids. B. Administer cough suppressant. C. Keep the child calm and monitor airway. D. Perform deep suctioning. Answer: C. Keep the child calm and monitor airway. Rationale: croup can cause airway obstruction. Crying worsens symptoms. Keeping the child calm and observing breathing is key. Suctioning may worsen edema, and cough suppressants are usually avoided. Question 7. A nurse is preparing to assess a 5-year-old child. What approach is most appropriate? A. Begin with invasive procedures. B. Ask the child if they want the parent present. C. Use short explanations and let the child handle equipment. D. Explain procedures using medical terminology. Answer: C. Use short explanations and let the child handle equipment. Rationale: preschoolers respond well to play and brief, concrete language. Handling equipment helps reduce fear. Invasive procedures should be last. Question 8. A nurse finds bruises in various healing stages on a 3-year-old's back and thighs. What is the first action? A. Question the parents about discipline. B. Notify Child Protective Services per policy. C. Document findings and monitor the child. D. Ask the child how the bruises happened. Answer: B. Notify Child Protective Services per policy. Rationale: mandatory reporting laws require healthcare providers to report suspected abuse immediately. Documentation should follow, not precede, reporting. Question 9. What is the best technique for obtaining a tympanic temperature in a 2-year-old child? A. Pull the pinna up and back. B. Pull the pinna down and back. C. Insert thermometer straight into canal. D. Use rectal thermometer instead. Answer: B. Pull the pinna down and back. Rationale: in children under 3, the ear canal is straighter and requires pulling the pinna down and back for accuracy. The up and back method is for older children. Question 10. A 6-year-old with asthma is using a meter-dose inhaler. What indicates proper technique? A. Child exhales after actuation. B. Child holds breath for 10 seconds after inhaling. C. Child skips using a spacer. D. Child inhales quickly and forcefully. Answer: B. Child holds breath for 10 seconds after inhaling. Rationale: holding the breath allows the medication to settle in the airways. Using a spacer and slow inhalation is also recommended. Exhaling after actuation is incorrect. Question 11. A nurse is caring for a 13-year-old with type 1 diabetes. Which teaching method is most effective? A. Use play therapy. B. Have parents perform all care. C. Use age-appropriate interactive tools. D. Limit information to avoid anxiety. Answer: C. Use age-appropriate interactive tools. Rationale: adolescents benefit from interactive, realistic education. They should be encouraged to participate in self-care. Question 12. Which action is most appropriate when administering an intramuscular vaccine to an 18-month-old? A. Use the deltoid muscle. B. Use a 5/8-inch needle. C. Inject into the vastus lateralis muscle. D. Ask the child to choose the site. Answer: C. Inject into the vastus lateralis muscle. Rationale: for toddlers, the vastus lateralis is the preferred IM site due to muscle mass and safety. The deltoid is appropriate for older children. Question 13. A nurse is teaching injury prevention to the parents of a 2-year-old. What should be emphasized? A. Keep small toys out of reach. B. Teach how to swim. C. Allow supervised stair climbing. D. Provide a nightlight. Answer: A. Keep small toys out of reach. Rationale: toddlers explore with their mouths, and choking is a major risk. Swimming lessons and stair use are better suited for older children. Question 14. A nurse is caring for a child newly diagnosed with leukemia. What is the priority nursing diagnosis? A. Risk for bleeding. B. Disturbed body image. C. Impaired mobility. D. Anxiety. Answer: a risk for bleeding. Rationale: children with leukemia often have thrombocytopenia due to chemotherapy or bone marrow suppression, increasing their bleeding risk. Question 15. A parent asks when to introduce solid foods. What is the correct response? A. At 2 months of age. B. At 4 to 6 months of age. C. At 9 months of age. D. At 12 months of age. Answer: B. At 4 to 6 months of age. Rationale: developmental readiness for solid food begins around 4 to 6 months, when infants can sit up and have reduced tongue thrust reflex. Question 16. Which action by the nurse promotes atraumatic care for a preschool-age child receiving an injection? A. Restrain the child forcefully. B. Avoid telling the child to prevent fear. C. Allow the child to choose the injection site. D. Use distraction techniques during the procedure. Answer: D. Use distraction techniques during the procedure. Rationale: atraumatic care involves minimizing distress with techniques like bubbles, toys, or guided imagery. Giving choices about the site may not be realistic. Question 17. A nurse is reviewing lab results for a child with dehydration. Which value is most concerning? A. Sodium 138 milliequivalent/L. B. Potassium 2.9 milliequivalent/L. C. Chloride 99 milliequivalent/L. D. Hematocrit 37%. Answer. B. Potassium 2.9 milliequivalent/L. Rationale. A potassium level below 3.5 milliequivalent/L indicates hypokalemia, which can lead to cardiac arrhythmias. Question 18. A child with varicella is hospitalized. What type of isolation should the nurse implement? A. Contact. B. Droplet. C. Airborne and contact. D. Standard. Answer. C. Airborne and contact. Rationale. Varicella, chickenpox, spreads through airborne and contact transmission. Proper isolation prevents nosocomial infections. Question 19. Which nursing action is most appropriate when obtaining vital signs from a toddler? A. Take temperature first. B. Begin with the most invasive procedure. C. Let the child hold the stethoscope. D. Perform all tasks quickly without interaction. Answer. C. Let the child hold the stethoscope. Rationale. Giving toddlers some control helps reduce anxiety. Begin with less invasive procedures and use therapeutic play. Question 20. What is the most important consideration when calculating a pediatric medication dose? A. Age. B. Weight. C. Diagnosis. D. Developmental level. Answer. B. Weight. Rationale. Pediatric medications are dosed based on weight, usually in kilograms, to ensure safe and effective treatment. Age and diagnosis may guide treatment, but do not determine dose alone. Question 21. What is the priority nursing action when caring for a 2-year-old with croup who develops stridor at rest? A. Administer acetaminophen. B. Encourage oral fluids. C. Apply a cool mist humidifier. D. Notify the healthcare provider immediately. Answer. D. Notify the healthcare provider immediately. Rationale. Stridor at rest indicates increasing airway obstruction and potential respiratory failure. Immediate medical attention is necessary. While cool mist may help, it is not the priority. Oral fluids and antipyretics are not appropriate in this acute respiratory emergency. Question 22. A 5-year-old child is scheduled for a tonsillectomy. What is the most important preoperative teaching point? A. Avoid eating candy the day before surgery. B. Explain the purpose of the surgery. C. Reassure the child they can speak right after. D. Teach to avoid coughing or clearing the throat post-op. Answer. D. Teach to avoid coughing or clearing the throat post-op. Rationale. Post-tonsillectomy care includes avoiding activities that could disrupt the surgical site and cause bleeding. Coughing and throat clearing should be discouraged. Other options are less critical to patient safety. Question 23. A nurse is assessing a 10-month-old. Which findings should be reported immediately? A. Pulls to a standing position. B. Responds to name. C. Does not sit without support. D. Babbles simple sounds. Answer. C. Does not sit without support. Rationale. By 10 months, a child should sit unsupported. Inability to do so may indicate developmental delay and warrants further evaluation. The other options are appropriate for this age. Question 24. Which immunization is contraindicated for a child receiving chemotherapy? A. Hepatitis B. B. Inactivated polio. C. Measles, mumps, rubella. D. Diphtheria, tetanus, pertussis. Answer. C. Measles, mumps, rubella. Rationale. MMR is a live virus vaccine and contraindicated in immunocompromised children, such as those on chemotherapy. The other vaccines are inactivated or toxoid-based and considered safe. Question 25. What is the best pain assessment tool for a nonverbal 8-month-old infant? A. Numeric rating scale. B. Flack scale. C. Wong-Baker-Faces scale. D. Visual analog scale. Answer: B. Flack scale. Rationale: the Flack scale, face, legs, activity, cry, consolability, is used for infants and nonverbal children. Other scales require verbal communication or abstract thinking. Question 26. A nurse teaches a parent how to give oral iron to a toddler. Which statement shows understanding? A. I'll give the iron with milk to avoid stomach upset. B. I'll mix the iron in orange juice for better absorption. C. I'll brush my child's teeth before giving iron. D. I'll give it right before bedtime with water. Answer: B. I'll mix the iron in orange juice for better absorption. Rationale: iron is best absorbed in an acidic environment like orange juice. Milk inhibits absorption. Brushing teeth after is more appropriate to reduce staining. Timing is less important than absorption factors. Question 27. Which child should the nurse assess first? A. 3-year-old with a barking cough and hoarseness. B. 4-year-old with fever and petechiae. C. 5-year-old with ear pain and low-grade fever. D. 2-year-old with mild diarrhea. Answer: B. 4-year-old with fever and petechiae. Rationale: petechiae with fever can indicate serious conditions like meningococcemia, which is a medical emergency. The other symptoms are common and less urgent. Question 28. A 6-year-old newly diagnosed with type 1 diabetes asks why he needs insulin. What is the best response? A. Your body doesn't make insulin anymore, and insulin helps sugar go into your cells. B. Insulin helps you feel better when you're tired. C. Insulin keeps your pancreas healthy. D. You need insulin only when you eat sweets. Answer: A. Your body doesn't make insulin anymore, and insulin helps sugar go into your cells. Rationale: this simple, accurate explanation matches the child's developmental level and reinforces understanding. Other options are misleading or incorrect. Question 29. What is a priority intervention for a child with nephrotic syndrome? A. Increase protein in the diet. B. Monitor for periorbital edema. C. Encourage fluid intake. D. Give potassium supplements. Answer: B. Monitor for periorbital edema. Rationale: edema is a hallmark symptom of nephrotic syndrome due to hypoalbuminemia. Monitoring edema helps evaluate treatment response. Protein intake, fluid, and potassium depend on labs and physician orders. Question 30. A 12-month-old had surgery and is now crying and restless. What is the most likely reason? A. Separation anxiety. B. Pain. C. Hunger. D. Confusion. Answer: B. Pain. Rationale: in the postoperative period, pain is the most likely cause of crying and restlessness in an infant. Separation anxiety is also common, but not the top priority immediately after surgery. Question 31. A 4-year-old receiving chemotherapy develops a temperature of 38.6 degrees Celsius, 101.5 degrees Fahrenheit. What should the nurse do first? A. Offer fluids. B. Administer acetaminophen. C. Notify the healthcare provider. D. Document and reassess in 1 hour. Answer: C. Notify the healthcare provider. Rationale: fever in an immunocompromised child is a medical emergency due to risk of sepsis. Prompt reporting is necessary. The other actions may be appropriate later. Question 32. What is the most appropriate toy for a hospitalized 2-year-old? A. Board game. B. Coloring book and crayons. C. Large building blocks. D. Video game. Answer: C. Large building blocks. Rationale: Toddlers benefit from simple, manipulative toys that promote motor skills and autonomy. The other options are not age-appropriate. Question 33. A nurse is preparing to give a liquid oral medication to a toddler. What is the best approach? A. Mix it with milk. B. Use a medication spoon or syringe. C. Pour it into a cup for self-drinking. D. Add it to cereal. Answer. B. Use a medication spoon or syringe. Rationale. Using a medication spoon or syringe ensures accurate dosing and delivery. Milk and food may alter absorption or mask taste. A toddler may spill a cup. Question 34. A child with cystic fibrosis is admitted for pneumonia. What is the priority intervention? A. Encourage oral fluids. B. Initiate chest physiotherapy. C. Administer 4 antibiotics. D. Provide oxygen therapy. Answer. C. Administer 4 antibiotics. Rationale. In cystic fibrosis with pneumonia, infection control is the priority. For antibiotics are essential to manage bacterial infections. Chest physiotherapy follows, but is not the first action. Question 35. What is the best way to explain a procedure to a school-age child? A. Use detailed medical terms. B. Explain using a doll or model. C. Let the parent explain. D. Avoid mentioning discomfort. Answer. B. Explain using a doll or model. Rationale. School-age children respond well to concrete explanations and visual aids. They benefit from understanding what will happen to them. Avoiding discomfort creates mistrust. Question 36. Which finding in a 3-month-old requires immediate intervention? A. Moro reflex present. B. Head lag when pulled to sit. C. Posterior fontanelle closed. D. Sunken anterior fontanelle. Answer. D. Sunken anterior fontanelle. Rationale. A sunken fontanelle suggests dehydration and needs urgent evaluation. The Moro reflex and head lag are normal at this age. Posterior fontanelle closure is also expected. Question 37. A 7-year-old is diagnosed with appendicitis. Which symptom supports a diagnosis of perforation? A. Sudden relief of abdominal pain. B. Right lower quadrant guarding. C. Nausea and vomiting. D. Low-grade fever. Answer. A. Sudden relief of abdominal pain. Rationale. A sudden relief of pain may indicate appendix rupture and peritonitis, a surgical emergency. Guarding and nausea are typical symptoms before perforation. Question 38. What should the nurse do when a child refuses oral medication? A. Hide it in food without telling. B. Document and try again later. C. Explain the importance in age-appropriate terms. D. Ask another nurse to give it. Answer. C. Explain the importance in age-appropriate terms. Rationale. Therapeutic communication tailored to the child's level promotes cooperation and trust. Hiding medication and deferring administration are not best practices. Question 39. What is a sign of digoxin toxicity in a child? A. Increased appetite. B. Tachycardia. C. Vomiting. D. Diarrhea. Answer. C. Vomiting. Rationale. Vomiting is a common early sign of digoxin toxicity in children. Appetite loss and bradycardia may also occur. Tachycardia is not typical. Question 40. Which action demonstrates family-centered care in pediatrics? A. Allow parents to visit during scheduled hours only. B. Limit parental involvement in decision-making. C. Include parents in rounds and care planning. D. Provide all teaching after discharge. Answer. C. Include parents in rounds and care planning. Rationale. Family-centered care involves collaboration, respecting family roles, and encouraging participation. Restricting access or delaying education contradicts this philosophy. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.